Good afternoon. I'm Lynn Simmons, your town manager in Long Meadow. I'm here today with Superintendent O'Shea and Chief Dearborn to update you on the town of Long Meadow's response to COVID-19 coronavirus and share with you some measures we are taking to slow the spread in our community. Marty will provide some updates from the Long Meadow Public Schools and share with you some important messages.
Sure. Thanks, Lynn. And as we start, I want to thank you and Chief Dearborn for being great partners over the last few weeks. This is obviously unprecedented territory that we're in, but I've appreciated the level of communication, the amount of information that you've been able to regularly provide. So it's been enormously helpful to me and my team. So thank you. So today, Long Meadow Schools made the very difficult decision to close schools from March 16th through March 27th, essentially the next 2 weeks of schools. And that was a decision that was made after some long and thoughtful conversations with education officials at the local and state level, my colleagues in neighboring districts. It was a decision that was made following significant conversation with local and state level public health officials. And so I understand that it's a very impactful decision and one that will present a challenge to our families here in Long Meadow. Schools, no doubt, are the heartbeat of the local community, and we understand that the normal operation to schools is something that provides consistency and stability to all families, and so during this closure period, I think our commitment is to remain engaged with Long Meadow families. Our teachers have been wonderful in terms of their commitment to sustaining learning over the next couple of weeks. Today, we had a professional development day by coincidence, and we devoted that to the development of remote learning opportunities. So it was a great chance for our teachers to come together collaboratively with a community-focused spirit to develop some lessons that can be delivered to families to sustain learning over the next couple of weeks. And certainly we recognize that there's no replacing direct classroom instruction. The value that students get from being in front of their teachers with their peers can't be replaced. But I think fortunately, I'd say we're ahead of many communities in terms of being in a go position. We have been thoughtful about the potential for a closing for a number of weeks now. So I feel like operationally and from a learning perspective that we're ready to go. Teachers spent time today figuring out how to communicate with families. They spent time today gathering resources and materials, identifying platforms on which to communicate with families and with kids. And I just admire their commitment. I think they understand the important role that they play in students' lives and in families' lives. The other thing that we hope to get out over the next few days is some resources for families. I think we have counselors in our schools who are really skilled at talking to students about difficult things, and they've identified some resources and collected some things that our teachers can use and that families can tap into as well. So we'll get that information out over the course of the next few days. There's a lot that we have to figure out. We encourage families to be in touch with us if they have questions or concerns. We need to surface the questions and identify the needs so that we can make sure that we can, as much as possible, sustain some sense of normalcy for kids and for families. So we're committed, and I hope families experience that commitment that we will have to families during the time that we're shut down.
Great, thank you.
So I first want to thank Marty and Lynn for their leadership. We're somewhat in some new territory here. I feel like we were very prepared for this, however. We formed a task force a few weeks ago, approximately 20 town employees. The school district has been in that task force, and kind of the process that we've looked at national, local, state guidance, these issues. We made a lot of plans up front, and as the situation changes, we're basically just pushing play on these different plans. So we're really not reacting to this situation. We've already put a lot of thought into the measures we're taking. So the strategy here is really to isolate, to slow the curve. The comparison of this virus can come through a community like a tidal wave and really make it a horrible situation, or can we make this come through like ripples on a pond? And that's really what all these measures are about. I fully understand this is difficult. It's something I've never experienced in my many, many years in public safety. But I want to assure the Long Meadow that we're well prepared for it. All of your public safety agencies are well equipped, we're well trained to handle this. I feel very confident at this point we'll be able to meet your needs. But we ask that our residents do their part. Please follow the isolation strategies. If you have a neighbor that's vulnerable or elderly, check on them, help support them. If you are one of those people that are vulnerable and elderly, our Council on Aging, although it's been closed, the phone number is still staffed and people are there. If there's a service that you need, please reach out to them. We are following all the CDC and Mass DPH guidance. We realize that a lot of the guidance, you can read something in multiple sources and it changes. You need to understand this is an evolving situation. We've had the same frustrations of perhaps many of you have experienced, that things change so rapidly. That's the nature of one of these outbreaks. The conditions change rapidly, and we're somewhat learning every day. But again, I feel like the town is well prepared for it. The current status is we haven't really seen any illnesses in our community as of yet, but based on all the scientific data, we will at some point.
And if I could just build on that, I think, Chief, you mentioned the sense that this had the potential to overwhelm service agencies and particularly public health officials. And our Board of Health has done an amazing job. They've been so responsive every time that I picked up the phone. And yet I also sensed that they were beginning to be challenged, and that at this local level and the state level, I could sense that public health officials were increasingly taxed. So I think your analogy about the sort of turning a potential tidal wave into a ripple is really, really important. The other thing I think that you mentioned, sort of that continuity of operations, and I would want to reassure the community in the same way that our administrators will still be available, our teachers will still be available via email. And so again, we really want to make as much of a commitment as possible to kind of sustain that relationship and sustain our commitment. We understand there's limitations. It certainly isn't as good as kids being in school, but I've got a lot of confidence in the work that our administrators and our teachers will do to continue to serve the families over the next couple of weeks.
Great,
Yeah.
great. So regarding the town's response, beginning Monday, March 16th, town offices will be closed to the public. Staff will still be reporting, and they'll be available to assist virtually via telephone, email, and mail. You can also visit longmeadow.org for contact information and updates, or you can call 565-4100. We anticipate that these measures will stay in place until March 31st, but that may change. We're constantly evaluating the situation. We greatly appreciate everyone's understanding and cooperation during these challenging times. We know there's a lot of uncertainty right now, but we're all in this together.
Yeah, well said. I think the idea that the partnerships that exist at the community level between town officials, school officials, and with our families, I think is going to strengthen us and help us, endure this challenge. The other thing I would kind of mention is that during the 2-week period, we've got an opportunity to really clean our schools, make sure we're following, all the cleaning advice that we've gotten from the fire department and from CDC and other agencies. And so, we have that chance to get our custodians in there. They've been briefed on the latest cleaning protocols. Chief Dearborn was kind enough to lend us time from his infectious disease specialist, Carl Vieira. So that's been enormously helpful too. So I think, if it is some level of reassurance to our families, is that we'll continue to work together very, very closely, and our staff, our teachers, our administrators are going to continue to be in a position to serve families as well.
Yeah, and Elaine, if I could just mention that, so the town website, longmeadow.org, we'll be posting information as it changes, but also on the left-hand side is our community messaging or emergency messaging site. I really would appreciate if as many of our residents can go and register there. We are going to, especially if there's immediate information that we need to get out,
Yep.
that's the platform we utilize. It takes 2 seconds. There's also an app for it. So I
Great.
really encourage you to go there. We will be using that through this to get information out along with our website, so, and social media.
Yes.
So,
And
Yeah.
final thought for me is just I would want anyone who's watching who might be an employee of the town, who might be a teacher or work in a town office, that their safety is a huge priority for us as well, and that was a factor in all the decisions that we've made
Absolutely.
over the last couple of weeks.
yeah, I want to thank all of our employees for their understanding. Everybody's been in this, committed to the success of the town to get through this, and I've heard no complaints. Everybody's, what do we need to do to get through this? And people are stepping up. We have some folks that are doing stuff that's not in their normal daily job, but they're getting it done. So it's really appreciated. That's part of your leadership, Lynn. So,
Thank you.
So
Okay.
thanks so much.
Yeah, thank you. Thank
All
you,
right.
and we hope that this provided you some information and some resources on where you can go to get more information.
All right.
Okay,
thank you.
Thank you both.
thanks.